So far, we have completed around 7 videos in the AV Fistula series. Today, it is the 8th video in the AV Fistula series. In this, as soon as the fistula is made, there are 5 important info the dialysis unit team have to convey it to the patient. Since fistula is also called the lifeline for the CKD patient, so the lifeline have to be saved at any cost. There should not be some random mistake by a patient which lead to the some issue with the fistula. So these important information to be specified. The 5 important info. The first one, very important. The patient have to be informed, or the attender have to be informed. The BP should not be taken in the fistula arm. So many a times in the exam, the examiner might ask, why so? If the BP is taken, what is the complication? See, for example, if the fistula is here, the vein, the outflow tract is going to the heart, and the artery is supplying blood to the fistula. While the BP cuff is inflated, the vein is tend to compressed first, then the artery. So the outflow tract will be compressed, whereas the blood supplied to the fistula through the artery, for example, the radial artery, the basilic artery, whatever it is, will be continued, and there will be a constant pressure in the outflow vein. There is a chance the fistula might rupture or it might open up if it is in the early post-op period. In the late post-op period, there might be formation of, in the subsequent days, there is a high risk of aneurysm. So in order to avoid any these kind of complication, blood pressure measurement in that particular AV fistula arm have to be avoided at any cost. And another issue with the BP cuff inflation is the stagnation of the flow. The stagnation might cause the thrombosis. So the stagnation and the imbalance in the BP and the high pressure in the fistula might lead to the rupture, and these are the two important reasons that BP should not be checked in the AV fistula arm. Many a times by mistake, the preliminary medico who are handling the patient might connect the BP app in the particular arm. For a moment, patient might have forgot, because in our clinic we have seen patient who forgot. We catched at the time before inflating the BP cuff. So time and again you have to inform the patient and the attender not to check the BP in this particular arm. And this scenario is also very common in the ICUs. If the patient is a case of CKD, make sure patient is, if they are having fistula, instruct the ICU staff not to check the BP or connect the cuff in the particular arm. This is the most important first info. Coming to the second one, the sleeping position. Many a times the patient while sleeping keep the left limb below the head while sleeping. That have to be avoided because that might lead to the fistula. So avoid keeping the forearm or the arm below the head while sleeping. How to avoid it? Just inform the attender or patient, tell them again and again, so that the fistula won't be damaged. Why? Because of the high pressure by the head to the outflow tract, again the venous stasis, chances of thrombosis. The decreased flow or the decreased arterial supply because of the compression by the head, again low flow, chances of failure the next day. So better to avoid or instruct the patient to avoid keeping the hand below the head while sleeping. The third important instruction, the patient have to avoid heavy weight lifting because there is a chance of fistula rupture. Up to 10 kg the patient can manage, and if it is the immediate post-op, better to avoid any kind of weight lift immediate post-op. As the first or second third month is crossed, On the non-dialysis days, up to 10 kg the patient can manage, but above which better to avoid it because there is a risk of sutural separation, risk of bleed, risk of aneurysm. So better to avoid heavy weight lifting. Another common question regarding this point is driving, whether they can drive two-wheeler or car or not. Yes, car driving is allowed. Two-wheeler driving in the immediate post-op period. In the immediate post-op period, better to avoid. Once up to 3 months is crossed, yes, they can drive the two-wheeler. It is not a contraindication. So this is the third important info to be given to the patient and the attender. The fourth info: avoid any tight fitting clothes. The tight fitting clothes have to be avoided because it might again the same concept as the BP cuff. Avoid tight fitting full sleeves or wherever the outflow tract is going, the vein should not be compressed. Avoid tight fitting clothes. The patient have to avoid the tight fitting clothes. Better to wear a loose fitting clothes. And the another common clinical scenario is the fifth one, the circumferential tourniquet after the AV fistula. In a tight position, it should not be tied because the outflow vein have to expand little bit so that the blood flow will be continuous. Suppose if the dialysis technologist after the dialysis, if they put a tight tourniquet, for example, this is the blood vessel, the entire tract might be compressed by the tight tourniquet. There is a chances of fistula going for the non-functional state. So that is why a experienced dialysis technologist have to tell the junior staff how to tie it. There should be adequate gap, a good amount of gauze piece have to be folded into a snugly fitting needle site, and a tourniquet loosely can be applied, and that have to be also removed maximum at the earliest point of time when the bleeding stops. So post dialysis, circumferential tight tourniquet have to be avoided. So these are all the 5 important instructions the patient should be aware of after the fistula creation. First, the BP should not be taken in the fistula arm. Second, the patient should not keep the arm below the head while sleeping. Heavy weight lifting in the particular arm is not allowed, or if there's a risk of sutural separation because of that. Tight fitting clothes have to be avoided, and the last one is the circumferential tight tourniquet have to be avoided. So this completes the video 8 of AV fistula. So I hope in the dialysis series I will switch to the catheter related videos from next video on, or if anyone wants the video related to AV fistula, the topics that we didn't cover, it is complications, the cannulation techniques is not yet covered, and one more thing yet to cover is the examination of the fistula. It is more of a DM topic, so I am in doubt whether to upload these or not. So probably next video might be related to the catheters. Okay, bye bye.